What happens to a biopsy specimen after collection? Imagine holding a tiny piece of tissue in your hand, knowing it holds answers about health. After a biopsy, that small sample begins a detailed journey to help doctors understand what's going on inside the body. First, the tissue is preserved to keep it from breaking down. Usually, it's placed in a special chemical called formalin, which keeps the cells stable and prevents decay. This step is very important because fresh tissue is fragile and can be damaged quickly. Once preserved, the tissue is sent to a laboratory for processing. In the lab, the tissue is carefully dehydrated by removing water and then embedded in a block of paraffin wax. This wax acts like a support, making it easier to cut very thin slices of the tissue. These slices are usually less than 5 micrometers thick, so thin that they can be placed on glass slides for examination. This process allows pathologists to see the tissue clearly under a microscope. Before looking at the slides under a microscope, the tissue undergoes a gross examination. This means the pathologist looks at the tissue with the naked eye, noting its size, color, and texture. This helps identify the most interesting areas to study more closely. Next, the thin slices are stained with special dyes. These dyes highlight different parts of the cells, making it easier to see abnormalities or signs of cancer. The staining process is essential because it helps distinguish normal tissue from cancerous or diseased tissue. Once stained, the slides are examined carefully under a microscope. This step can take several days, especially if the sample is large or complex. The pathologist looks for signs of cancer, checks how many cells are affected, and determines the type and grade of any cancer found. After the examination, the pathologist writes a detailed report. This report describes what was found, including the size and appearance of the tissue, the microscopic findings, and the diagnosis. Sometimes, additional tests are recommended if the results are unclear. Families and caregivers can ask the healthcare team to explain the report in simple terms. This process helps everyone understand what the results mean and guides the next steps in treatment. Knowing what happens to a biopsy specimen after collection can make the journey through diagnosis a little less confusing and more understandable. The careful handling and detailed analysis of the tissue are what give doctors the information they need to plan the best care for their patients.